of prevention of GBV in emergencies. If you would like to put your name and where you are dialing in from, or where you're coming in from in the chat, that would be great. It's always good to see so many familiar names and organizations represented here at our webinar series. If you could please keep your videos off, because we have so many people calling in from low-resourced areas with not very strong connections, we do find it useful for everyone to keep their videos off so that everyone has a good chance to stay online. We will also request that you stay muted throughout the presentation. If you have any questions, please do write them in the chat. My colleague, Christine Cabelle, thank you, Christine, will be monitoring the chat today. And she will be putting like questions together, and then during the Q&A, we'll ask them to me. So please, if you have any questions, please do write them in the chat, and we will try to address them at the end if there is time. Okay, without any further delays, I'm going to get started. So first, the reason that we have selected prevention as the focus of this series, or actually this webinar, and we will be also addressing it in the future as well, is because the Regional GBV Working Group for East and Southern Africa last year, late last year, sent out a capacity building survey to our member organizations. And we had over 300 people fill out that survey across 21 countries. And the survey was really trying to assess what topics you all would like us to address here at regional level in terms of some of our learning events. And the 4 topics that were, or thematic areas that were identified, were MHPSS, so mental health and psychosocial support, also the 16 minimum standards, and then also preparedness, and then lastly, actually not lastly, but the 4th thematic area was prevention. So we are going to consider this the first of many learning events and activities around the concept of prevention, since it was identified as one of the key areas that you would like to have additional learning around. So just note that. And as always, this webinar and all of our additional learning events you can find on our YouTube channel. And if you just look at GBViE AOR on YouTube, you'll see our YouTube channel, because we do upload all of our events to our YouTube channel. All right. So I thought it would be good for us to think a little bit, or to get an overview of what we mean about prevention. And UNHCR developed this following video that I think gives us a good summary. So let's watch this video, which will give us a summary of GBV prevention approaches in programming. And then we're going to dive a lot deeper into specifically primary prevention.
GBV prevention approaches in programming. Gender-based violence, or GBV, is preventable. GBV prevention programming is life-saving. Let's look at the 4 types of prevention approaches. The Interagency Minimum Standards for GBV in Emergencies Programming categorizes GBV prevention approaches as follows: risk mitigation, primary prevention, secondary prevention, tertiary prevention. Risk mitigation aims to reduce the risk of exposure to GBV through all aspects of service provision. How? By addressing contributing factors to GBV that might expose women and girls, as well as other at-risk groups, to increased risk of violence. An example would be integrating features to increase safety based on consultations with women and girls and other at-risk groups. It could include providing more lights in camps, ensuring enough well-marked, sex-segregated, and lockable latrines and bathing facilities, ensuring that shelters have privacy features and are allocated in a way that reduces risks for women and girls in particular. Primary prevention focuses on preventing GBV before it occurs. How? By tackling the root causes of GBV: gender inequality, systemic discrimination, and unequal power relations. This approach requires long-term transformational change to focus on positive norms. The social, economic, and political empowerment of women and girls is integral to the program design, as is addressing impunity for perpetrators of GBV while engaging men and boys in GBV prevention. Structured, evidence-based, tested, and proven long-term programs may be employed. Secondary prevention focuses on response for survivors and consequences for perpetrators. How? By addressing the consequences of the violence, mitigating the harm this violence can cause, and taking steps to prevent the violence from happening again. These include availing healthcare, case management, psychosocial, and legal support services for GBV survivors. Tertiary prevention includes actions that focus on the long-term impact of violence when untreated. How? Through working on community reintegration and acceptance, addressing trauma and the long-term medical and psychosocial needs of survivors. Now that we are familiar with the 4 categories of GBV prevention approaches, it is important to remember that safe, ethical, and effective GBV prevention programming must ensure that essential services for health and psychological support, at minimum, are functional before embarking in transformative social norms and systems change interventions. Staff and volunteers working on prevention programming are aware of how to safely refer GBV survivors who disclose GBV during community outreach activities and wish to access support services. Local systems and norms and how they sustain gender inequality and GBV are understood. A gender and power analysis would help shed light on this. Intersecting forms of oppression, discrimination, and marginalization based on coexisting identities are mapped out. Intersectionality is an important element to understanding gender and power dynamics. Implementation and outcomes are jointly monitored with communities to mitigate risks and address unintended harmful consequences. Accountability to women and girls is critical to safe, ethical, and effective GBV prevention programming. It is key to securing women's and girls' full and equal rights. The meaningful participation of women and girls must be ensured in all stages of programming. Partnering with women-led organizations, particularly those led by asylum seekers, refugees, stateless, internally displaced persons, or returnees, is essential. It is an opportunity to support and sustain localized action in addressing GBV against women and girls in humanitarian action. GBV prevention programming is essential for the protection of women and girls in particular. This remains the primary outcome of prevention programming. Remember, GBV is preventable. GBV prevention programming is life-saving.
Great. I think that was a good summary of all the things we're going to kind of talk about today. It mentioned 4 different types of prevention, but we're really going to focus on primary prevention. And a lot of the information that I'm sharing today comes from a few primary sources. One is the resource that you see on your screen now. And this is the primary prevention framework for child protection and humanitarian action. So this framework provides guidance for humanitarian workers on the key actions and considerations to apply when developing or implementing programming to prevent harm to children in humanitarian settings at the population level. And this is a great resource because, as we know, that in many contexts, the majority of our survivors of GBV are often children or individuals who are under the age of 18. So many times when we talk about child protection, and just in this resource as well, we're also talking about GBV. So I think keep this in mind as one of our resources that you can always reference in the future. It does give you a broad range of activities and then also some principles to think about that we're going to also talk a little bit about today. Just to very quickly summarize what was said in that video. When we look at prevention from these three different levels, this is really in accordance with a public health model. And so we've also in the GBV sphere have added risk mitigation. And we're not going to cover risk mitigation today because that's a whole other, especially for a lot of us working in the GBV sector, that's a whole other sort of intervention. But I thought this illustration was a good way to kind of summarize the target groups, because I think this is where oftentimes people have a little bit of confusion between the three different levels of prevention. When we look at primary prevention, we can see that it's really community-based, right? So it's the entire population in a way. And if we're looking specifically at child protection, then it would be all children in a community or population. We know that gender-based violence disproportionately affects women and girls. And so our target groups would obviously in primary prevention would be women and girls, but now we're also recognizing the impact that this phenomenon has on men and boys as well. So it truly would be a community or population level intervention. When we look at secondary prevention, we often look at groups of children at high risk for harmful outcomes. So those are specific groups that are particularly vulnerable, for instance, to gender-based violence. We could talk about, for instance, in Somalia, or actually let's look at DRC. We have a lot of vulnerable population, adolescent girls living in IDP sites in the northern part of DC who are being forced into working in brothels, for instance. And so we might set up a secondary prevention intervention that would specifically target that high risk group, those out of school adolescent girls living in IDP sites. And then we have tertiary prevention, which often looks at the individual who has experienced harm. And so again, you can find this illustration in that framework that I had just mentioned. The reason I think it's important for us to focus on primary prevention is because there's so little known, I think, especially in emergencies, about primary prevention. And also many times in emergencies, we don't focus on primary prevention. We focus a lot more on the tertiary and the secondary prevention. So as a starting point for this discussion, as I mentioned, this is the first in a series we hope to do. We would like to focus on primary prevention. When I use the term primary prevention, it means addressing the drivers of violence against women, specifically by promoting gender equality. And I'm going to show you what that means in practice as well, because I know it's a lot of words put together that sound really fancy in a way. The aim of primary prevention is to stop violence before it happens, full stop. So if you're taking notes, put that one down. So the aim of primary prevention is to stop violence before it happens. This means that primary prevention is different to other kinds of interventions that address violence against women and children, right? Interventions that occur when the risk of violence is already there is often called early intervention in some ways, but also, as we saw in the previous slide, that's what we kind of designate as secondary prevention. And then doing something about violence that's currently happening is often called the response or the tertiary prevention. And as I mentioned in that previous slide, that's where we look at individual, down to the individual. So just to reinforce that primary prevention interventions work with whole populations, not just people who have used or at risk of using violence. So in terms for us, examples of primary interventions could include, let's see, like an action plan for workplaces to recruit and retain women in leadership positions, because we know that having women in positions of power is one way to reduce exposure to GBV. Social marketing campaigns, for instance, about gender stereotyping. Another would be advocating for change to laws, for instance, would be a primary prevention. But let's take a deeper dive into all of this. When we look at gender equality, as we noted, right, that primary prevention means addressing the drivers of violence against women by promoting gender equality. And studies have been done, and you can see here, I've cited all of this where I've gotten all this information, but studies have been done that have shown that as gender equality improves, the prevalence of violence against women is lower. And this graph here, this chart illustrates that. And this is specific to physical or sexual or intimate partner violence. And this study looked at 56 countries. And those with higher gender equality scores had lower prevalence of violence against women. So this really shows, I think, that the importance of looking at some of those longer term changes, right? But that's kind of the difficult part of this, isn't it, in an emergency, is how do we actually look at longer term changes when we're looking in emergency situations specifically? And I'm not sure we have the answer to that question, but we are going to challenge ourselves today to start asking more informed questions about how we can do it. So one of the ways that research has shown us that you can sort of institutionalize prevention is through education. Educating girls, especially through secondary and higher education, can help reduce violence against women and delivers multiple returns to national, social, and economic development. So there is a desk review of a series of studies that were done, and it really looked at the impact of education in terms of reducing the prevalence of violence. And so we see here that investment in girls' secondary education is associated with lower rates of intimate partner violence based on a series of studies that was done. So keep that in mind when we're looking at areas where we, even in emergencies, can do interventions. There is evidence that shows by integrating into education systems or increasing education, particularly of girl children or adolescent girls, that there is research that shows, quantitative research that shows good outcomes in that way. This is just a small evidence. I think what we do know, and what became very clear to me as I look more and more into how we can institute preventative measures in emergencies, is that there is still a very limited evidence base and even an expertise in how to design and implement effective primary prevention strategies. This is somewhat universal, but there is even more limited evidence when we look at the experiences in emergencies or humanitarian contexts. To be honest, I found very little information about successful intervention programs and policies. And we know of some. We know, for instance, that Raising Voices, which is out of Uganda, have done some great work. We know that we have lots of organizations that are now focusing on the role of men and boys. Both, for instance, IRC is one of those, and there's lots of other male-specific organizations who are working on primary prevention. But in terms of whether that's been collated and, in terms of like academic rigorous research, we're not maybe there in that phase, in my opinion. But that could also mean that maybe I'm not also looking in the right ways. But I think generally, we do have more bodies of evidence in more developed countries or industrialized countries, and then also in more specific areas of interventions. But we can also learn from that, which is what I hope we will in fact do. So prevention approaches may reduce, but will never eliminate the need for effective referral and responsive and remedial services. So experience in non-humanitarian contexts has shown that a shift to primary prevention approaches may initially increase the need for response services, as awareness and reporting of child protection, and then also of all types of GBV issues in a community grows. So this is why it would be unethical for us to integrate or institute primary prevention, or actually any time of prevention approaches, especially in humanitarian contexts, without first having response services in place. The evidence shows us that once we start a primary prevention approach, that it will increase the need for response services. Since we do have that evidence, then we need to make sure that we have those response services in place. So again, if you're taking notes, take note of that as well, because that's another key point. So primary prevention and response programming are integrated and essential components of a holistic response. Interventions to strengthen GBV or protection systems, such as building workforce capacity, increasing awareness on the risks and vulnerabilities of women and girls, or investing more in the social service workforce, will support both prevention and response approaches. So a lot of the information in these next few slides was taken from a review, and you'll see the down below the articles that I'm taking from. And it was a compilation of a desk review of evidence that's out there. And I'd like to present some of the findings to that, specifically here, when we look at primary prevention and what works based on the evidence that's out there. Until recently, in humanitarian settings, most interventions were really targeted toward the individual level. And I think we can all, probably those of us that work in humanitarian settings, can attest to that, that we look more at the tertiary and the secondary prevention, which is really about, as we mentioned, mitigating risks, existing risks, and then also preventing once we've already identified a survivor. And that's through response services, if you remember. That when we look at secondary, it's about early intervention, and then we will look at tertiary, it's about the response services. So generally, in my opinion, in my 20 years of experience doing this work, now in a lot of our partners and experts on the ground or organization on the ground really do focus on the secondary or the tertiary. And a lot of times they do focus on that is because where donors are willing to fund those types of activities. And it's also something that can be implemented many times in a short cycle. Now, when we look at primary prevention, we're looking at more, if we remember what the ecological model is, for instance, we're looking at prevention from both the individual, the societal, the community, and then the institutional level. And we can imagine how that would look in an emergency. It might be very difficult. And this is probably why we don't actually have a lot of scholarship around this, and then outcomes and quantitative research around it, because it's hard to implement, right? Because you have to have, long-term sustained interventions for over, many times people say behavior change, for instance, takes up to 5 years to see results. And so we can kind of think of the context in which we work in emergencies and really kind of reflect if that's, realistic. It can be, but we have to think probably a little bit more thoughtfully, I guess, on how we do that. So as a result of this desk review about kind of what works in primary prevention, they came up with 5 areas that they saw some positive outcomes. And we're going to talk about each of these areas, and then also think about how we can maybe reflect in emergencies if these are areas that could be enhanced in an emergency. So the first one is education and public awareness, specifically early education. And that previous slide and when I showed you the education outcomes of adolescent girls, it showed, didn't it, that there was a direct link to lower rates of intimate partner violence. And so this is another set of studies that's kind of showing us the same, that one of the main areas of intervention are education and public awareness. Specifically, early education and awareness raising is considered critical to reduce the prevalence of violence toward women and girls in societies. Successful educational campaigns have targeted children, youth, women, and also society as a whole. The literature has shown us that the main aims of these educational programs are to change attitudes toward how we view love, sex, and violence. And then also, critical to this is to provide students with alternative skills to resolve conflicts. So when we're looking at the focus of education, we're also looking in these key areas. And also, as suggested by health behavior literature, interventions which were peer-based were most promising. So just think about that for a second. Also, a broader awareness of risk factors for abuse and available resources within a community helps to interrupt also the cycle of violence. And so they saw also success when programs were training community-based facilitators to identify and support women who are at increased risks of violence. So a couple takeaways from that first point. One is early education is key. The subjects of that education, we need to look at alternative conflict resolution mechanisms, how both girls and boys view violence, sex, and how they view love in relationships. It was also suggested that peer-based education or learning was promising. And then that was further reinforced by this concept of training community-based facilitators as well. Let's go on to that next one, the safety and support programs. So I won't spend as much time on this one, but really it's about initiatives that are meant to improve the safety of women and girls. What does that look like? So that would look like, for instance, community safety and crime prevention programs. In humanitarian settings, we often would kind of categorize if we have community policing or volunteer policing mechanisms, perhaps. Also, interestingly, they put telephone hotlines in this category as well. And we know during COVID that there was a proliferation of hotlines that were set up. And so in some areas, people would consider a hotline a primary prevention mechanism. But let's go back to the legal as well, because that's another, I think, point that many of us deal with in our work. So when we look at legal policies, we know that many new policies are currently being developed in East and Southern Africa, at least, that look at reducing crime against women and girls, but then also overcoming the barriers to women and girls actually accessing the criminal justice system. So it's about actually expanding laws to include crimes based on a victim's gender. As we know, in most countries, there's a recognition of physical violence as being illegal. But somehow when we enter into the gender dynamic, if it's physical violence that's perpetrated against a wife by a husband, suddenly it becomes a bit more murky. And so what this is saying, that another primary prevention intervention is looking at even at existing laws that might exist, but making them more gender reflective. Okay, and now I want to go, I think, lastly into early identification, because this is also another one, I think, for us, could have some interesting implications. So when we talk about early identification, it means that it's really critical for us to ensure the safety of women and girls, or to prevent further victimization, really, right? And when they talk about early intervention, they look at it through the lens of health. And so health professionals, especially primary care physicians that work in rural areas, are often the first point of contact for survivors of GBV. We know this from GBV IMS data, that, again, often the first point of contact for a survivor of gender-based violence is at the health center. But many studies have indicated that health professionals frequently fail to recognize and effectively intervene in cases of GBV. Evidence has shown, or the data showed, that a substantial proportion of women or survivors who presented to doctors or healthcare providers had previously sought attention for injuries on multiple occasions. And only a small fraction of those women's visits and this study was specific to intimate partner violence, were actually documented correctly as abuse related. So what does that mean? That means that women are going to health centers with injuries related or inflicted by a perpetrator of GBV. And they're not being documented that they are related to abuse, which, as we know, marginalizes and minimizes, right, the impact of this phenomenon. So much of the research in this area has been concerned with the identification of barriers to physicians' diagnosis and interventions in the cases of abuse. And this is another area that I think in a humanitarian setting that we can have, or we can affect change. Because generally the evidence was showing that healthcare providers lack knowledge and training around the issues of GBV, that they also retain the same sort of social and cultural norms around GBV, that they have this sort of same attitudes that oftentimes the general population does in terms of the cultural and social norms, the stigma associated with it. That also there's a lack of supportive institutions, that there aren't protocols in hospitals on how to deal with survivors of GBV, a lack of a community awareness around it. And then what's interesting as well is the research has shown that there's a lack of interdisciplinary teams and collaborative partnerships within communities. And we're trying to address that, right, through these one-stop centers, which we've had varying degrees of success with. So there is some literature around the use of one-stop centers as a primary or in terms of early identification. I guess it's ancillary or tangential, but it is there. So this is when we talk about early identification as a primary prevention measure, it really looks at when we talk about educational interventions, right? On behalf of healthcare providers, that we have screening tools in place, that we have policy initiatives in place at healthcare facilities, that we have health professionals who are able and feel confident to intervene. And I think this is another area where we can intervene in humanitarian settings as well. And then lastly, I know we're running on time here, but lastly, let's look at this empowerment and life skills development for women as the fifth. And really, I think in our sector, this is a lot about economic opportunities, isn't it? They mentioned empowerment and life skills development for women, but I'm going to go one more and also say transformative empowerment and life skills development. We haven't even talked about transformative approaches, but I think it could also lend itself here. So studies do show that when women are not provided with concrete tools to modify their social or economic circumstances, that violence is likely to reoccur. So this is really about resilience in a way, isn't it? And also, it's not only about increasing economic opportunities, but at the same time, we also have to, if we're talking about primary prevention, looking at longer term, we also have to look at, in the same intervention, about building self-esteem and addition to increasing skills and resources. Because I bet a lot of you on the line now have examples that if you don't treat also sort of the mental health and the psychosocial aspects of long-term violence, then it's really, you can have the best primary prevention programs in the world, but if those aren't addressed, then it's also really difficult for us to change the cycle of abuse, even on different generations when it's generational. And I want to talk about these economic opportunities because many times people will say in emergencies, we do cash and voucher assistance, right? We do cash distributions, basically, one-off cash distributions. Is that a primary prevention generally? In my opinion, no, because it's not transformative. What would be an economic primary prevention is if you change the cycle, right? If you change of a population base or of women, particularly women and girls, vulnerable women and girls in a population, if you change their long-term trajectory towards economic sustainability. So cash and voucher assistance, which could fit into other types of prevention, right? It could fit into the early intervention, secondary prevention, and in some ways tertiary prevention. But a standalone just cash distribution, I would not put necessarily into primary prevention because, as I mentioned, it's not transformational. We don't see, So when we look at, as an example, because I think many times people get confused about all these different levels, and this is a good, perhaps maybe a way to explain that when we look at economic opportunities, it's about not just handing out cash, it's about doing business. If the goal is to make women and girls more, economically independent, then we can look at larger scale education programs that promote girls perhaps even going to university or staying into secondary school, right? We can look at business classes for women and girls across the population that would lead to, right, longer and more sustained economic development. But again, also note this, that the research tells us that we can't just do these standalone, that initiatives that facilitate the development of supportive networks and empower women should also be supported. So again, kind of looking at some of the other ways, right, when we looked at early identification and others, that really it's about building it up from a community level. Okay, very quickly. I know I don't have so much time left. I'm going to take another 3 or 4 minutes. I think this comes from the framework that I mentioned in the beginning, from the Child Protection Framework. And I won't go over these individually, so just take a few seconds to look at some of these prevention principles that really should be mainstreamed throughout any kind of prevention intervention. We should really make sure that we're context specific. Here comes this ecological model again, address the multiple levels of the social ecological model. When we're looking at primary prevention, remember, it's not about the individual, it's about the population level, right? So that's why it's so important, the socio-ecological model. And that's the individual, the community, the societal, the institutional levels. Again, we need a multi-sectoral approach. And we often look at this as well. I think this goes hand in hand with risk mitigation in a way. We also need, when we're implementing programs, to have log frames that measure outcomes, and not just the availability or the development of programs, but all actual outcomes that force us to measure change as a result. And that's really tough when we're doing long-term behavior change programming, isn't it? And then, of course, my favorite term, anybody who's attended any of my trainings, you know I love the strength-based perspective. And I'm glad to see it here as a prevention principle as well, which is really looking at the resiliency of women and girls from a strength-based approach, and developing program objectives that are designed really, right, or aimed to strengthen women's resiliency. So facilitate community ownership, as we noted in many of those 5 areas, primary interventions, that linking the intervention into community networks was a key aspect of success. This, of course, was from the Child Protection Framework, so it said be child-centered and inclusive. But I think we can also learn from this as well. And then what's interesting is bridge development and humanitarian systems. And many of those represented on the line today know or work in countries that are on a nexus between development and humanitarian, or you're in places like Somalia and South Sudan where you're in a protracted crisis. And so it's really now important for us to recognize some of those distinctions. So very quickly, let's look at what works, some of the lessons learned that we were pulled together here. And I apologize, there's a lot of words on this slide, but I wanted to make sure those of us who are English as a second language, sometimes it's really, since this is such, again, based on research, I wanted us to have it there on the screen. So if you wanted to see it later as well. So lessons learned. And again, this is a compilation or from a desk review. So and as you notice, a lot of the resources are very old. It was very difficult for me to find relevant resources to our context as well. But I think really still applicable. So primary prevention is most effective when diverse methods such as community mobilization, mass media, and awareness raising, school-based approaches, and policy changes are combined and employed at different levels of society. I think that's a key takeaway. Primary prevention efforts are more effective when they aim to both transform individual and collective attitudes, beliefs, and behaviors related to gender norms and roles in a given community. And 2, it's important to implement local and national strategies to empower women and eliminate gender disparities. Because we know the key to primary prevention is to ultimately, the goal is to reach gender equality. Interventions that target change at the interpersonal, relational, community, and societal levels, or those that facilitate broader community mobilization against violence, can have a powerful effect on individual behavioral change. And then lastly, primary prevention initiatives require long-term planning and investment. It may only be realistic to expect changes in knowledge and attitudes within a short time frame, but changes in behavior can take at least 5 or more years. And that's 5 or more years of sustained interventions. So it's not about having a workshop, a 3-day workshop every year over the course of 5 years. This is sustained engagement over the course of 5 years. I'm noticing the time, and I do want us to make sure that we're able to end on time. So why don't I take just a couple minutes? Kabeli, do we have any questions?
Yes, we have 2 questions.
Okay.
One is about one person is asking, so laws may recognize that GBV is a criminal act, but sometimes, when you come to the ground, laws may not be upheld by judges sometimes. So what kind of potential solutions can we recommend for this? And then the second question is, can male engagement also be an element of prevention approach through building
Yeah.
allies?
Yeah, it's a really important one. So I'll address those two because we do have a few minutes left at least, but really good questions about the law aspect or the legal policy. Yes. So it's not enough. And I think there are many countries in this region, in East and Southern Africa, maybe not many, but there's quite a few that have some very progressive laws around GBV. But as you rightly mentioned, it's the application or practice of those laws that are the barriers. And so I think this just reinforces sort of that social ecological model that not only do we need to raise awareness at community level of these laws or at the individual level, community, societal level, but we can't forget the institutional level as well, which means that we have to make sure that judges and others also have the capacity. So one intervention that has been somewhat successful, for instance, I've worked in Liberia many, many years ago, and in other countries as well. I've seen, at least in the beginning, they've set up specific courts to deal with cases of GBV, particularly in Liberia, because the prevalence of gender-based violence was shocking after the war in Liberia. And so they set up specific courts, not even family courts. These were specific to deal with the cases related to GBV. And organizations trained the judges on the penal code, and we did see success in that way. And so it really raised a lot of awareness and visibility around the issue. And then the next phase, if we're really talking about primary prevention, it's also to integrate this kind of learning at all of the law schools. And it's not just in Africa, countries in Africa. I mean, I am from the US and we still struggle a lot with the implementation and the application of laws when it comes to, I mean, many of you have probably seen the news, right? Protecting the rights of women and girls. And then in male engagement, I didn't mention this enough, but it's a key component. And as I think I mentioned it at the very beginning, that we do have lots of not lots, but quite a few really well-respected organizations who are engaging men and boys, not just as perpetrators, but as allies and as key interlocutors to be able to prevent future acts of violence. So I think we're going to actually have a future session on male engagement. So I didn't go into that specifically, but I think when we talked about those 5 key areas of intervention, we could have had male engagement be an intersectional aspect to all of those. So really good point, and I'm glad you brought it up as a reflection. So thank you. Okay. I'm going to stop here because I do want to make sure that we stick to our hour. I want to thank you all for joining us today for our April edition of our Emerging Practice webinar series. As I mentioned, we are going to be delving more deeply into a lot of these elements because it was identified by all of you in a way as one of the areas that you would like to have more learning around. So please keep in mind that you will see more invitations talking about primary prevention, but then also we're going to get into those other areas of prevention as well. So we're really excited to also with you go on this journey in terms of looking at prevention more holistically. If you would like to review this webinar or any of our previous webinars, please don't hesitate to find our YouTube channel, which is if you go into the search engine on YouTube and look up GBVAOR, you will find our YouTube channel. So thank you all for joining us today for the April edition of the Emerging Practice Webinar Series. Again, my name is Jessica Gorham, and I'm the Regional Emergency GBV Advisor based here at UNFPA in Nairobi, working on behalf of the GBV AOR. And thanks for joining us, and I hope to see you at one of our next events. Thanks, everybody.
Thank you, Jessica. Bye.